Thank you for participating in our neuroregenerative peptide project. We're going to be sending you a package, or we will be giving you a package which will have a certain number of things in it. Maybe a package that looks a little bit like this, which will have a cold pack to keep everything cool while you're using it or while it's shipped. And that will be a container with syringes and sterile saline for dilution, along with the NRP and a sheet with directions on how to mix it up and inject it. So you should take the bags and examine to make sure that you understand what they are. There will be a series of syringes which you can use to inject the NRP into your patient, and also the saline which you can use to make up the NRP. The NRP itself should be stored in the freezer, and then when you use it and make it up, you'll be using the entire sample and discarding the rest. So we mix up the NRP basically by taking the saline. You'll have to remove the cap. You should get some alcohol wipes that you can get from a drugstore, or you can use rubbing alcohol and cotton. There will be a syringe contained in the pack which you can use to pull some of the saline out. You'll need to attach a needle with it. Be careful because obviously the needles are sharp. And you can insert the syringe, withdraw a 1/2 ml, which is marked on the syringe. It's a relatively small volume in a 3 ml syringe. That 1/2 ml will be what you will use to mix up the NRP. So once you've drawn that 1/2 ml and move it to the line, you can carefully recap it. Just don't stick yourself in the process. And then the NRP, when you've brought it from the freezer, you can open that and as carefully as possible inject the saline into the NRP solution, recap it, and mix it completely until it's entirely dissolved. Once it is dissolved, then we're going to use another syringe, which will be an insulin-like syringe. Uses a relatively small needle, so it won't be harmful to your dog, and only has a 3/8 inch long shaft. It looks like this, but it will come in a package that you open up, and these are sterile needles. So you'll open up that needle, you can discard the packaging material, and then there will be a cap which you will remove, and from that you will withdraw all of the solution that you mixed up in the NRP into the syringe, and that will become what you will inject. You may get some air bubbles, and if you do, then just essentially pull the syringe back up a little bit. You can cap it in the meantime so you don't hurt yourself. And you can flick the syringe a little bit just to get the air bubbles to rise, and then very carefully move it until most of the air bubbles are gone. If you lose a little bit, that's okay, but try not to lose too much. So basically that's a syringe. From there, we're going to inject the NRP into the caudal thigh of the leg. This is kind of a model of a dog, and in the caudal thigh, if you grab behind the leg, you can usually feel a muscle just like we would feel. To isolate the muscle, you'll wipe that with one of the alcohol wipes or with some rubbing alcohol and cotton. You'll take the syringe that you've made up, remove the cap, insert it into the belly of the muscle. You should pull back slightly, make sure you don't get blood because it's designed to go intramuscularly, and then basically push the plunger all the way. These are very small needles. Most animals do not mind it at all, and hopefully you won't have any problem.